that fuse in the center. We're not going to go into that detail. We're just going to call them maxillary bone or maxillary, if you don't mind. This is one maxillary bone here. Maxillary bones, you've got it. These are the maxilla or maxillary bones. Okay. These bones have several surface markings associated with them. The pointer is in one of the two infraorbital foramen. Infra, below the orbit. Infraorbital foramen. Infraorbital foramen. Infraorbital foramen. It is true that the supraorbital foramen are associated with the frontal bone. The infraorbital foramen are associated with the maxillary bone. Then we come to the palatine process, incisive foramen, inferior orbital fissure. Okay. Is everyone okay with where the inferior orbital fissure is inside? It's repeated several times, I understand, because several bones help form it. Part of the sphenoid and part of the maxillary bone, right? Help form the inferior orbital fissure, just for clarification here. Inferior orbital fissure. Inferior orbital fissure. Can you see why I wouldn't just ask you about the inferior orbital fissure by just having the sphenoid bone? I could, but it's better if it's if it's the sphenoid and the maxillary. I'd like to move on, please. Incisive foramen and palatine process. Okay, this is the maxillary bone, not a problem, right? This is a part of the maxillary bone. Remember you were looking at this earlier? Okay. These two plates that you see here are part of the maxillary bone. They are called palatine. There's no N. Palatine. Palatine processes. Palatine processes right here. But they end here. These are not palatine processes. These are part of the palatine bones. They're their own unique bones. So I'm probably going to point up here for the palatine processes. Palatine processes. Don't they help form the hard palate? Palatine. Are they what does not fuse correctly with a cleft palate? A cleft palate? Palatine processes. Now we come to the incisive foramen. You've got it. Okay, these are the incisors here. So these are the incisors. So this hole between the two incisors is called the incisive foramen. Incisive foramen. Now, there are vessels that pass through that foramen. We just can't feel them completely because of the skin that covers, the gums that cover all those vessels. Incisive foramen. Incisive foramen. You can also call it fossa. That's why I have it in parentheses, because there are some texts that use fossa. I don't really understand, because the fossa is like a groove, but they interchange those terms sometimes. Are you okay with incisive foramen? I'd like to move on to palatine bones. Again, let me just repeat this one more time. The palatine bones are the most posterior. They are posterior to the palatine processes, and I would probably put the tape at the end here so there would be no question that these are the palatine bones. They too help form the hard palate. Palatine bones. They are posterior to the palatine processes. Palatine processes are part of the maxillary bone, right? I'd like to move on. The zygomatic bone is your cheekbone. So you should be able to recognize the maxillary bone and the zygomatic bone. Now there's a surface marking called the temporal process. This is